you know, we see the population in Saudi is really digital native and very accepting. How does that play out? Like, do you think the adoption of technology will be easy for healthcare? Like, people are comfortable using technology to attend to health, or?
So we are a tech-savvy population. We've witnessed those national applications and how a lot of, or majority of the population are using it. Now we have Sahati app, which has over than 30 million. So imagine and how we can target the population health and where we can have and identify any risk hazard to the population. So I'm a big believer in the digital transformation. At the end, I see it as a healthcare professional as tools. These tools, it empower me as a healthcare professional, and it empower as well the patient.
Absolutely. And I'm gonna again shift gears because you touched on it earlier, the many initiatives. There's so many ministries and entities sponsoring incubators, accelerators, investment, like smooth lending, and so on. What do you think is still a gap yet to be filled by maybe a different type of entities that maybe can harness local talent or local research that is actually being left in the drawers of universities? So what is your view on, like, you know, we're not saying here something is necessary or no longer necessary. It's an ecosystem. But do you think, what's missing currently in the ecosystem?
So one of the things that we see missing, actually you mentioned academia, we see the frontiers of innovation as actually in the academic sector. Part of a research lab, they are inspired every day to solve many challenges or critical challenges. And their research, unfortunate, what we witness here in the region, from the perspective that I see, is that their aim is to publish at a high impact journal. One of the things that we did is how can we nudge them, which is a concept which is a research translation. This is a beautiful outcome. You published it. Let us see the light. Let's nudge you in creating your minimum valuable product. When I talk with researchers in the healthcare field, and I tell them about, let's create an MVP, and they're like, what is an MVP? And how can I establish my startup? And all of that business aspect is missing. So how can we bridge the missing, let's say, gaps and trying to solve it and trying to guide them? So what we do with the Innovation Enablement Center and the Ministry of Health is we try to navigate them. So we have a navigating office where we navigate them through this complexity, field, and streamlining. I haven't witnessed anywhere around the world where 17 government and semi-government entities are sitting at one table just to enable innovation. And each entity, they have a KPI. So how many intellectual property have been issued? How many SFDA approval? How many license? How many investment? How many funding? So all of them are sitting, cheering for those entrepreneurs to make it into the market.